Yeah.
Um, okay, so thanks again for meeting with me. I know we didn't anticipate recording this, but you were in a zone, and I felt that it was important that we record this so that we can share. So I'm Leticia Vaca with Urban Health Group. We help people plan for medical emergencies. I have a chance to sit with Gerardo of Amazing Smiles and learn that he does mobile dental cleaning. So please share a little bit about your service, because this is the first time I heard of it.
Yes. Oh, well, thanks for having me. I appreciate you reaching out. So my name is Gerardo Reinaga Gonzalez from Amazing Smile. And what we do is we're a mobile dental hygiene service practice. So what does that mean? That means I come to your home, or I mean, whether it's your private home or assisted living facility, memory care facility, anywhere where there's a patient, where there's a resident, I'm allowed to come and see you. So that means that all the services that I provide is the same services that you get every 6 months at a brick and mortar dental office. So that means all the assessments, dental cleanings, whether it's a regular cleaning, deep cleaning, fluoride treatments, all of those treatments that you get every 6 months at a dental office, I bring it home. I bring it to you. So
Okay.
that's what we do.
No, that's super cool. You brought up nursing homes and assisted living. I know that sometimes, from my experience working in the hospitals, that when people are preparing for certain surgeries, they need to have dental cleaning or have their teeth assessed so that there's no infection. What does that look like when you go to a nursing home to do someone's cleaning?
Well, it's super easy. I mean, I bring all my equipment with me. I bring my chair. If the patient's mobile and they're able to use my chair, I bring my own chair. If they're not mobile, whether they're bed bound or wheelchair bound, I'm able to do the cleanings or all their services in their bed or in their wheelchair. A lot of people, they like lazy boys. So if they have a lazy boy that
Yeah.
reclines, which helps a lot. So we can do it there too. So it's, I mean, again, I bring all my equipment. I bring my compressor, which is a section that gets all the water out of your mouth. And I bring all my tools that cleans your teeth. I bring the ultrasonic scaler, which is top of the line scaler, which is a little machine that goes around your teeth, removes all the bacteria. Not everybody uses it. I don't know if you had it done before. So I can do old school hand scale, or I can
Okay.
use the ultrasonic. I can do both.
Okay.
Yes. And
Super
I mean, and
cool.
again, everything comes with me. Everything goes back with me.
Okay. And
Mm.
what areas do you service?
So I do Contra Costa County, San Francisco County, Alameda, and Marin County, or the south side of Marin County.
Okay.
So from Novato all the way down.
Wow. So you cover a lot of areas because
I
Contra
do
Costa
cover a lot
County
of
is
area.
pretty long.
Yes,
Nice.
yes, and I did that because I mean I do see a very specific clientele or patients, so I had to get a bigger area to cover in order for me to be able to see more people or
Okay.
more patients. Yes.
What what is your target, folks? Who tends to seek mobile dental cleaning?
So pretty much, like I said, anybody who has lack of mobility issues,
Okay.
that's who I target. But my main target people will be memory care. I
Mhm.
am a memory care provider, certified provider. So
Okay.
that's the people that I target. But
Mhm.
again, anybody who needs my services, again, whether it's at a private home or or a facility, not just a living facility, just any facility,
Right.
I'm able to service them. But I mean, my target area, my target population will be memory care.
Wow, that's awesome. We talked about it briefly that during COVID, people prevented certain care options. I know I took a year off at least getting dental cleaning. Do you also see people who just don't like going to the dentist?
Yes, I do have a few people where they have phobia to the dental office, or they have phobia to be seen by a dentist. So I do help those people as well, and I do encounter those situations where again they have phobia of the dental
Right.
office. So yes, I can come see them as well.
Okay. And can you share with me a little bit about payment? What, how does that work in working
Mhm.
with you? I think sometimes it's really helpful to know, because if people have coverage or they don't,
Mhm.
sounds very luxurious. So
Yes.
tell me a little
So
bit about
it's
that process.
Yes, it's super easy. I mean, I do have a assessment fee. I don't have a trouble fee, but it's just like an assessment fee,
Uh-huh.
which is $99. I can come and see you, and I do all the assessments. I do all the intraoral photographs that I need to take. And once I have all that information, I'm able to do a tailored treatment plan depending on your needs. And then that's when I can give you like a quote for the type of service that you need, whether say regular cleaning with fluoride, with antimicrobial rinses, or if it's a deep cleaning. And again, same services, antimicrobial rinses and fluorides. So once I have all the assessments done, that's when I'm able to give you a more accurate quote
I see.
or treatment plan. I shouldn't say quote, a treatment plan,
Mhm.
depending on the needs of the patient. But again, just for me to come out and see you, it'll be just $99.
Okay.
And
Um,
if they have insurance, I'm able to build insurances if it's a PPO insurance. For example, Delta Dental PPO, MedLife PPO, any insurance that has a PPO plan, I'm able to build them. Again, I'm not a preferred provider, so I don't do what I'm trying to say is I take payment up front and then I build insurance and then the insurance reimburses the patient.
yeah, that's a similar process to what we do with psychotherapy, that
Mhm.
sometimes people get intimidated about not seeking a service that might be beneficial to them because of that payment option.
Mhm.
But a little bit more about super bills and what that means about utilizing your insurance outside of a network preferred provider. What that looks like is you pay up front and you get reimbursed from your insurance directly back to you at
Yes.
an agreed rate. So it's not usually 100%, but depending on your insurance, it could be anywhere from 70 to 90%. But you want to
Mhm.
always contact your insurance provider to see what that reimbursement rate is. But again, we don't want you to delay care for
Yes.
that reason, especially if you have a phobia or a fear or just an aversion to going to
Mhm.
the dentist. So I was really happy to stumble across your service, because I know a lot of people personally just don't like the dentist. What would it be like to be at home in an environment you feel comfortable with?
And that's exactly why one of the reasons why I did it, just because I mean a lot of people were lacking on their healthcare or their oral healthcare just because of phobias, just because of mobility issues. Well, now I can take all those things out of the equation because I mean by me coming to you, I'm coming to a uh, an environment that you're comfortable with, which is your home, which is your room, which is your living room, you name it, a place where you feel comfortable, a place where you feel safe.
Right.
Now I can get those services to you, which helps a lot.
Good. So you're taking the barriers out of people accessing quality
Yes.
care. And you had mentioned to me, people deprioritize their dental care needs. But it's
Mhm.
as important as any other type of routine checkup, right? Is that
Yes.
from your
Yes.
experience?
Yes. I mean, definitely. I mean, especially because I mean, when we don't take care of our mouths, what happens? We start getting halitosis, which is bad breath. We start getting deficiency, vitamin deficiency, because you're not having all the vitamins that you have to take in. Um, so all those things come into they play a role in your overall healthcare. So by having a clean, healthy mouth, you're able to have all your vitamins. You can have your normal diets, and you can have a healthy overall health.
Yeah, yeah. And coming back to how I'm aware of the importance of dental care as a healthcare provider, former healthcare provider in the acute care setting, they will literally cancel your surgery if you require certain type of procedures through the mouth if you have not
Mhm.
gone to the dentist. So this is a huge resource for folks to get access to this necessary service. So thank you
Yeah,
so
it's
much.
no, thank you. Yes, and it's important that you mentioned that because a lot of MDs nowadays they are requiring their patients to have dental cleaning prior to surgery, especially if you're having hip surgery, knee surgery, like a full joint replacement surgery. They are requiring all the patients, not all the patients, but most of most of the doctors now are requiring for the patients to have healthy clean mouth before surgery, because we know that the bacteria that's in our gingivitis or in the gingiva can travel to the weaker areas, which is, again, it could be your hip, your knee, whatever area it's being replaced, whatever area is being serviced, that bacteria from our mouth can travel to those areas and cause an infection. So it's really important that you mentioned that.
Yeah.
So yes, a lot of MDs are, one of the requirements is to have dental cleaning prior to surgery.
Anything else you want people to know about your service or the importance of keeping your teeth clean?
Well, just like I mentioned before, I mean, just having overall general health, everything starts with the mouth. So just staying on top of your dental cleanings every 6 months, and some patients more often every 3 months, depending on their oral health status.
Right.
Whether it's a healthy mouth, then, I mean, you come see me or I come see you every 6 months. If you require periodontal treatment, like a deep cleaning, then we see each other more often. It could be between 3 to 4 months, which means 3 or 4 times a year instead of 2. So yes, it's really important to stay on top of your oral health.
Yep, and Amazing Smiles can help you do that. How can folks get a hold of you?
It's super easy. I mean, it's a brand new website that it was redesigned. So they can go to my website, they can fill out the form, or they can call me at 510-504-3005, or my email, which is my first name, Gerardo, at amazingsmilehygiene.com.
Thank you so
and again,
much.
my phone is my cell phone, so they can call me, text me. I mean, I'll reply to them.
Okay. Making it super convenient for folks to connect to you. So thank you for sharing your resource. We'll definitely let folks know. We want you to keep your mouth, your mind, your body clean and healthy. So
Yes.
thank you for sharing.
No, thank you. Thank you.
Thank you.